Under the administration of Governor Zulum, the health of Borno citizens remains a paramount priority. This commitment is reflected in a clear, actionable strategy to build one of the nation's finest health systems. The proof lies in the ongoing construction of new hospitals and the comprehensive renovation and cutting-edge equipping of existing facilities, all concrete steps towards fostering a healthier, more productive population. Yet, a critical challenge persists, not only in Borno, but across Nigeria: a severe shortage of skilled health workers. This is where institutions like the College of Health Technology in Maiduguri become vital, producing the middle-level personnel essential for achieving universal healthcare coverage. Guided by Governor Zulum's vision, the college's provost Malam Burakome has tirelessly worked to reposition the institution. With over 20 years of experience there, Comey has drawn on deep institutional insight to lay a solid new foundation for the college, directly supporting the administration's effort to mitigate the healthcare manpower deficit.
The journey to this office started when I was a student between 1987 to 1990 in the then School of Health Technology, Maiduguri, when I was trained as a public health superintendent. And I was posted to Zonal Health Office Monguno as an area health officer, and I rose to the rank of Deputy Zonal Health Officer. When I went for further education in the University of Maiduguri, and I read BSc Biochemistry, I was requested by the then principal of this school, then it was a school, that there was a particular course that they need my service. So I used to come and teach every week and go back to my duty station. Then they observed that since my service is needed, why not, since I'm a staff of the State Ministry of Health, transfer my service to the school so that I will impact more. I was transferred to this college. By then it was a school in 2008 as a senior tutor in the Department of Environmental Health Science. And I rose to the rank of Assistant Exams Officer, then an Exams Officer, and then the Head of Department of Exams and Records Department of the school. When this school was upgraded to a full-fledged college in 2016 by His Excellency the Executive Governor and now the Vice President as a full-fledged college, I was appointed as the acting registrar. I held that capacity of being an acting registrar for 8 years, 4 years under Alhaji Bukar Modu when he was the pioneer provost, and another 4 years with Mr. Daniel Hassan, who preceded me. And I was appointed to this exalted position on the 28th of August, 2024.
Inspired by the governor's drive to expand infrastructure and the consequent growing demand for professionals, the provost has introduced new departments and expanded others to meet the state's need.
When I came to this college, I can say that I contributed. The school then runs analog system. My coming to the Environmental Health Department as an exams officer brought in the first digitalization of our exams process, when we used to release the results using computers instead of the analog. So that contribution, in fact, identified me as somebody who can contribute positively to the college. And that is why they appointed me as the head of department of the exams and record department. When this college was a school, we ran only 4 departments. As a college, in 2019, when His Excellency came on board as the executive governor, he came very much prepared, as one of his 10-pack agenda is healthy citizenry. Now, he called on us. He is very conversant with the happenings globally and in Nigeria. So he said that, why are you running only 4 departments of community health, medical lab science, health information management? He has seen other colleges with many programs. He promised to support us. Let us introduce new programs. And that is how we created 4 new departments, 4 additional new departments to make it 8. And we ran 14 different programs. Hitherto, we ran only 6 programs. Now, these new departments include the pharmacy technician department. Then when the database of health workforce registry showed that there were only 4 certified pharmacy technicians, because this course is not done in the state, we brought in pharmacy technician program. Currently, we have graduated from 24 sets. And another department that is so important and so dear to His Excellency, because of his recent commissioning of 2 dental hospitals. Even in our dental hospital, we had only about 4 dental therapists. So we introduced the new department of dental health. And His Excellency, in his generosity, supported us to procure equipment for the training of dental therapists and dental surgery technicians. Hitherto, we requested, and the whole of our request was granted. He supported us financially and by other means. When the board was invited for resource verification, in fact, the initial intention was to train only dental surgery technicians, a 3-year program. But when they saw our equipment, they said that you can train both the dental therapists and the dental surgery technicians. This is the second department. The third department is Department of Public Health Science. This department trains personnel that take care of preventive health, where they, instead of allowing everybody to be sick to go to hospital, there are interventions that they render at homes and public places that will prevent diseases. We run 2 different programs, epidemiology and disease control, and then public health technology. The latest department is the Department of Dispensing Opticians. This department trains personnel that take care of vision problems by recommending and giving appropriate glasses to those who are having sight problems. Because the 2 eyes may be having different focal lengths, so they can create the appropriate glasses. We are expecting to have our first graduates in September 2026 by the grace of God. So with the addition of these 4 new departments, we have 8 departments and 8 academic departments. And by the grace of God, we will introduce more, because we have the intention of introducing medical imaging technicians those people who can work in the radiography department, because the full-fledged degree holders in radiography may not wish to work in places that are remote. So this middle level healthcare manpower will assist the state government in achieving a lot. Because when you want to achieve healthy citizenry, as stated in his 10-pack agenda, one of the measures to achieve this is to achieve adequate, well-distributed human resource for health. And let me inform you that this college is a multidisciplinary college. If you go to other colleges, maybe they train only what we call curative staff. They can only cure you when you go to the hospital. Here, we are having those that keep the health record. For you to plan well in the health sector, you need the health information technicians. Here, we train the medical laboratory technicians. They diagnose diseases that the doctor needs to know exactly what is wrong with a patient. Here, we train community health practitioners. This cadre of people work both in the households and in the clinic. They can treat and conduct what is called home visit to know what are the remote causes of health challenges. You know, when they continuously visit homes, we train two cadres in the community health department. The junior community health extension worker, the acronym is JCHU, and the CHU, the community health extension worker. You know that extension workers do go and meet you at your residence to render services. The CHUs render their services 60% in the clinic, 40% in the society or in the community, while the JCHUs is the reverse order, 40% in the clinic and 60% in the communities. We also have pharmacy technicians. Go around our hospitals, you can hardly find pharmacists who are trained to be rather producing drugs rather than dispensing drugs. But by the introduction of this pharmacy technician program, you can find qualified personnel that can handle our drugs in a potent manner. So we train pharmacy technicians. They assist in keeping the drugs in a potent manner and dispensing appropriately, because it needs this cadre to tell you when to take your drugs, how to keep your drugs potent. Some drugs are taken before meals, others are taken after meals. Some drugs are taken once while going to sleep. Some drugs, they will instruct you not to drive while taking the drugs. So the dispensing optician department is a very new department. We invited the Optometrist and Dispensing Opticians Registration Board of Nigeria in 2025 after we admitted 30 students, and they made recommendations that these are the equipments you are going to install in your optical lab, ophthalmology lab. These packages you are seeing are the equipments worth about 15 million naira, automated and manual, so that we train our students appropriately.
This progress was echoed by college leadership, including the Director of Laboratories Department, Director of Public Health Sciences, as well as the Head of Dental Technology Department, detailed the institution's developmental strides.
Precisely, medical laboratory science medicine is the vital department in the medicine of overall, because they are the roots and the diagnosis in the medical sector. So the importance of medical laboratory science cannot be overemphasized, because without the medical laboratory practice, the hospital service cannot achieve its goal. We have to appreciate His Excellency, Professor Umar Zulum, MNI, for upgrading this college. If I can remember last year or last 2 years, he set a committee to look into our problems in order to upgrade this college to be a poly college. Because when we are mono, we are limited to train some cadres, which are also very vital in the health sector. But with his inceptions as a governor of the state, he set that committee and give them a mandate to fish out a way in order to improve this college. So we appreciate his effort for that. Yeah, this college now have been upgraded with almost 14 or 16 different courses, which are the key courses that are required in the health sector. And by mere seeing, even if you come to the college now, you can know that the college now have changed from the previous mono to poly now. So actually, we really appreciate his effort. Our intake in the college, like the medical laboratory department now, we have over 366 students. And every year, we used to graduate, we can register like 150, 160. Like this 2025 that recently passed, we registered almost 160 something, and 125 passed.
The department was created in the past years, that is 2002 precisely, and 22. And so far we have graduated 2 sets of students. And Alhamdulillah, based on the result we recorded in the past years, the first year we recorded 100%, while the last year's result was around 94%. When His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, came in, the first thing when he came to the school, he said he wants us to expand the institution. And one of the way to expand it is to add more courses. And Alhamdulillah, by that his instruction and the support we received, we have so far increased about 5 more courses. One of it, the dental science department. We have the DOP department, my own department, that is public health sciences. We also have HPE, health promotion and health education and promotion department. We also had another program called WASH, water sanitation and hygiene. So these are the new departments so far established during the periods of Professor Babagana Umar Zulum.
The Provost Malam Burakomi Mangano and the entire management staff expressed their profound gratitude to His Excellency Professor Umar Zulum for his transformative support of the college.
Not only me, even those who cannot read and write, some of them are even saying that we can hardly get a replacement for Professor Baba Gana Umar Zulum because of his style, because of his love for his people. This is a governor who will be attending a function in Abuja. When he hears that something is happening in Borno, he immediately goes back home. Since he's coming, he came with a plan, and he included the health sector by stating a very explicit agenda of having healthy citizenry. Without healthy citizens, you can achieve less. So we thank him most profoundly for supporting the health sector in general and for supporting the College of Health Technology Maiduguri in particular. Words cannot express my gratitude to His Excellency.
Dr. Bura Mangano also highlighted the instrumental role of the Commissioner of Health, Professor Baba Malam Gana, whose unwavering dedication has been crucial to these innovations. He especially acknowledged the Commissioner for heeding Governor Zulum's call to leave Europe and return home to serve his people.
Let me also start by thanking His Excellency for finding our astute professor of neurosurgery from far away Britain to come and make his own contribution to the health sector. This can only be said of His Excellency for finding that highly qualified people such as our Honorable Commissioner, Professor Baba Malam Gana, who has been in far away United Kingdom. So for him to scout for such type of people, to convince them to come and render their services to the state is a blessing. Because generally, if not because of His Excellency, our workaholic governor, they only work with politicians around them, but he can scout for professionals from far and near to come and contribute to building back Borno better. And let me thank the Honorable Commissioner for making such a huge sacrifice to leave the comfort of Europe to come and render his service to his people. Since his coming, they have been rendering huge support to the college and generally to the health sector. Because when this college was ravaged by the flood of 10 September 2024, he called the two provosts then of this college and that of nursing and said that we are going to do everything possible to restore academic activities soonest, because our training is a national training. You can have only one national exams per program every year. So if you lag behind, they will only leave you behind. So he came immediately and rendered, he said that he is ready to render all support so that you restore academic activities soonest. And that brought us to how we recovered very quickly.
Focusing on the college's development, students acknowledged and appreciated the government's support.